Hi, my name's Nick Davis, and today I'm joined by Dr. Katelyn Campbell. Hi, Katelyn.
Hi, thank you for having me.
You're welcome. And today we're going to talk about what makes Blast so efficient. So, Caitlin, just before we go into that, just tell me a little bit about yourself, what you're a doctor in, and whereabouts you're based.
Yes, so I'm a doctor of psychology. So I'm a licensed psychologist in South Carolina, the United States. And I have a private practice where I specialize in treating trauma and eating disorders.
Fantastic. So you've studied Blast. You're a Blast practitioner now, soon to be doing your advanced Blast practitioner. Um, Tell me, from as a perspective of a doctor of psychology, what do you feel makes Blast so efficient, maybe compared to things like EMDR?
hmm Absolutely. So I did the full EMDR training and liked a lot of components about the experience. But one of the things that really stuck out to me is how long the planning process could kind of draw out. And when thinking about some of the more recent research on how really efficient reconsolidation windows happen within the brain to really optimize the processing of trauma, um, doing an approach like blast that is a lot more efficient and kind of directly like kind of to the root of the issue seems to return such a powerful result in the clients that I use it with.
Brilliant. And what research or whose research was that you found that
Yeah,
from?
so yes, I'm thinking about the work of Joseph Ledoux. Has written several books on neuroscience, but specifically has had a couple studies on this theory around reconsolidation that happens, that there's this really kind of short window that you can really optimize when someone is accessing a memory of trauma to then quickly get into the part of processing it versus kind of asking someone to kind of continually access it over weeks without actually getting to the part where you're actually addressing it and treating it.
And there was a metaphor, I think you said, forgive me, I may have added something to your metaphor, that you kind of said it was like going underwater, and I kind of likened it to kind of going down to dive for treasure and then coming up with the treasure, handing the treasure over, and then going back down and diving again. And you compared that to EMDR, that was kind of like going into the water, but then coming out and getting dressed again and dried, but having to go back in again. If you can just, so I love the metaphor. So just touch on that if you can.
Absolutely. I love that the process of blast has these moments where you can sort of metaphorically come up for air. It's a
Yeah,
really compassionate way to sort of have the client have that element of safety and control in the process, but you're not asking them to just dive right in and then essentially get completely out of the pool, redressed, and then say, okay, can you dive back in again?
yeah,
We're going to naturally have a reaction that's like, I don't know, I already did that. And
yeah.
so Blast really optimizes like, hey, you're going to go in and we're going to do this, and then you can get out and you don't have to go back in again.
So what do you think is the emotional impact or for a client by doing it in the blast way that keeps them absorbed in the work for a quicker time?
I feel like based on the feedback that I've gotten as well from clients is that it's a much more kind of efficient and compassionate process where you feel really responded to, really like listened to and respected during the process. So it's not asking them to relive an experience, but it's essentially saying, oh, we'll just get in and take care of it and move you right through it and get you on the other side. So we're not kind of trying to leave you with this open-ended thing that you've just sort of opened up.
Brilliant. Caitlin, thank you so much for today. I'll speak to you on the next video. Thank you for your time.
Thank you so much.